everybody. I manage the Essex County Child Abuse Project for the District Attorney. That would be DA John Blodgett. I've been with the District Attorney for actually almost 20 years now. So it is true, I have seen my fair share of some of the most horrible cases that come across our venue within the District Attorney's Office. The Child Abuse Project is a project that was developed in 1983. So we've been around for a while, and our purpose is really to bring together a multidisciplinary team approach to investigate cases when children have made allegations of horrible sexual assault and serious physical abuse. We need to do this in a partnership. We have always done this in a partnership since 1983. And our partners in investigating these cases are the Department of Social Services and local law enforcement. It doesn't take a lot to think about the difficult nature when children make such terrible allegations of abuses against them. It requires a sensitive community approach to not only investigation, but to look beyond investigation to remediation. Because, as Colette said, these children clearly experience not only being abused, but then the lifelong effects of the trauma that occurs from this abuse. It's not just in the criminal investigation that looks to who has perpetrated such a crime against a child and what can we do to not only make that child experience some justice in their life, but also to look at the larger community and how can we protect other children from individuals who commit these sorts of crimes. It really is looking at not just that, but looking at how these children can remain safe in their homes, safe in their communities, and again, to begin healing and recovering from the abuses that they have experienced. Having said that, the project is just one small piece in that whole puzzle. And it wasn't long after the project was developed that there was a recognition that it wasn't just the Department of Social Services, law enforcement, and the District Attorney's Office who really needed to come to the table for these kids. It was a larger array of professionals. And in the early 2000, in Essex County, we began to look toward enhanced models to provide those sorts of remediation services for children. Since that time, we have partnered with North Shore Children's Hospital in a project known as the Children's Advocacy Center model. Some of you may have heard that. It's relatively new in Essex County, which is exciting, but it's also had its bumps and grinds in its growth process, as many of these partnership programs do, because it's hard to bring people to the table, especially when, even though our goals are really the same, which are the safety and protection of kids, sometimes our means to get there are a little different. And so coming to the table has been an enlightening experience, but has also been an incredible challenge, an exciting challenge. The Children's Advocacy Center model really enhances the investigation model. And while we still work together with the Department of Social Services, local and state law enforcement, and within our office, district attorneys and victim witness advocates, we are now sort of looking toward the hospital system to provide appropriate and sensitive and specialized medical examinations for these children, as well as mental health services and recovery services. So it's an exciting time to be at the beginning of this model, and I'm very happy that this is happening in Essex County. And I really encourage that you learn more about the Children's Advocacy Center and that you support the Children's Advocacy Center in any way that you can, because it really truly is a benefit for all the children. I am very pleased to be able to come and speak to you about this. I'm very happy. Hopefully I can meet some of you, because I'm sure that our paths cross in terms of the children that we see and that we serve. And I want to thank you all for the great work that you do